Welcome back, everybody, to another deep dive. Today, we're taking a closer look at cervical intervertebral disc disease in small breed dogs. You've given me some really interesting research on this, and I'm really excited to break it down and figure out just how C-IVDD, as we call it, how it presents in these different breeds and what the latest research says about something called disc-associated vertebral instability.
Yeah, it's definitely a fascinating area. And this study in particular, I think, brings up some really interesting points.
Right off the bat, I was surprised to learn that IVD in general, it's fairly common, but C-IVDD actually only makes up about 15% of all the cases.
Yeah, and what makes it even more interesting is how differently it can present clinically between, chondrodystrophic and non-chondrodystrophic breeds.
So like dachshunds versus chihuahuas.
Exactly.
What makes that happen?
Well, the underlying pathology of the disc degeneration is different. So in the chondrodystrophic breeds, like your dachshunds, the nucleus pulposus undergoes this early degeneration. So it becomes cartilaginous and it's prone to extrusion, which essentially means it bursts out of the disc space and puts pressure on the spinal cord. But in the non-chondrodystrophic breeds, it's a much slower process with, gradual degeneration, and they tend to have more annular tears.
Got it. And this study was really interesting to me because they looked at a significant number of dogs. It was 307, I think, right?
Yeah, 307. And it was over a long period of time.
Yeah.
From 2000 to 2021.
Wow.
So it's a pretty significant
Pretty good
data set to look at and get some, really solid information from.
That really helps, I think, set the stage for talking about this disc-associated vertebral instability. What exactly is that and why is it important?
So DIVI basically means that the degeneration of the intervertebral disc leads to instability of the spinal column itself. And so that instability can kind of exacerbate the neurological signs that you're going to see with C-IVDD.
So it's not just the disc herniation, it's the fact that those vertebrae themselves are unstable.
Yeah, exactly. And this is actually the first study to look at breed-specific differences in C-IVDD and vertebral instability in these small breeds.
Interesting. What were some of the key findings that they had?
Well, they found that non-chondrodystrophic dogs tended to be older when they developed C-IVDD than chondrodystrophic dogs.
Interesting. What do you think the implication of that is?
Well, it means that you might not see the typical, signs of C-IVDD until they're older. So it's just something to keep in mind in those non-chondrodystrophic breeds. Even if they're seemingly healthy, older, small breed dog, it could still be C-IVDD.
Good point. Were there any other breed-specific findings that really stood out?
Yeah, so French bulldogs tended to be the youngest to develop C-IVDD in this study. Dachshunds were more likely to have C-IVDD in the cranial cervical discs,
Wow.
and most non-chondrodystrophic breeds had C-IVDD in the caudal cervical discs, which is similar to what we see in large breed dogs.
Okay, so even within the small breeds, you've got quite a bit of variation there.
Yeah, absolutely. And then they also found that male dogs with C-IVDD in the caudal cervical discs, and the non-chondrodystrophic breeds were all more likely to have vertebral instability.
Okay, so certain factors do seem to increase the risk then. What are the implications for that when it comes to treatment?
Yeah, that's the million-dollar question, right? Because instability can really significantly impact your treatment decisions, especially when it comes to surgery.
Okay, I think we should definitely delve into that a little bit more. How do they even diagnose this instability? It's not like you can palpate it, right?
No, you can't. So They use a technique called dynamic myelography, which is essentially a real-time X-ray of the spinal cord while they're manipulating the neck. And so this allows them to see if there's any dynamic compression or instability that they might not appreciate on a static MRI.
Wow. That sounds really detailed.
It is, and it seems to be much more sensitive at picking up these subtle instabilities than MRI.
So dynamic myelography is kind of the gold standard for diagnosing this then?
It seems to be, yeah, especially in these, breeds that are predisposed to the instability.
So when we think about treatment options, then how does this vertebral instability kind of change things?
So, a lot of times we do a decompression surgery, like a ventral slot, to relieve the pressure on the spinal cord from the herniated disc. But if there's significant instability present, then we may need to do a vertebral stabilization procedure as well.
And what exactly is that?
So it's a procedure where we use pins and bone cement to fuse those unstable vertebrae together.
Wow, that sounds like quite the procedure.
It's a little bit more involved, but in cases of significant instability, it can be really important to do that, to get long-term stability and have a successful outcome.
What were the outcomes like in this study?
So the good news is that most dogs had great outcomes, regardless of whether they had the stabilization surgery.
That's good to hear. But I imagine Like with all retrospective studies, there's got to be some limitations, right?
Oh, yeah, absolutely. So, they're relying on data that's already been collected. So there's always a possibility that, there's missing information or inconsistencies in how the data was recorded. And then also the number of dogs in some of the non-chondrodystrophic breeds was relatively small, so it's hard to draw, really firm conclusions.
So I guess the message is more research is needed.
Absolutely. But it's a great starting point, and it gives us some really valuable insight into, the complexity of C-IVDD and vertebral instability in these small breed dogs.
Yeah.
And, it also raises some really interesting questions about how we can, approach breeding programs to maybe minimize the risk of this in the future.
That's a great point, and I think that's something that we definitely need to talk more about. Why don't we take a quick break, though, and come back and explore those implications in more detail.
And we're back talking more about C-IVDD in our small breed patients. One of the things that I thought was really interesting in this research was this new staging system they've proposed for intervertebral disc degeneration and instability.
Yeah, they're calling it the DI stage, right?
Right. And it's really interesting because it takes into account both the degree of disc degeneration as well as the instability. So it kind of gives us a better picture overall than just looking at one or the other. It ranges from stage 1, where, you have no compression in a neutral position, but when you stress the spine, you see instability, all the way up to stage 5, which is vertebral fusion from, chronic degeneration.
So it's kind of like a roadmap of how that condition progresses.
Exactly. Yeah.
But how do they even catch those early stages, like those subtle instabilities? How do you see that before it becomes a real problem?
Well, that's where these, advanced imaging techniques come in. So the dynamic myelography that we were talking about earlier, that's really helpful because we can see how the cord is moving within that vertebral canal when we manipulate the neck. And so that can show us these instabilities that, maybe we wouldn't appreciate on a regular MRI.
So that dynamic myelography is really becoming essential then.
It's very valuable, especially in these dogs, that are predisposed to that instability.
Okay. I think we should probably talk a little bit more about the treatment options specifically when we talk about surgical intervention. What exactly is that vertebral stabilization? Like, how does that work?
So essentially, we're trying to fuse those unstable vertebrae together to create this solid bony union. And so the surgeon will carefully expose those vertebrae, and then they'll use these specialized pins to align the vertebrae and hold them in place. And then they'll use this medical-grade bone cement called polymethyl methacrylate, or PMMA, to create a solid bond between those vertebrae. So it's essentially like we're welding those vertebrae together.
Wow. So it's pretty intense.
It is a specialized surgery.
Right.
And it's performed by veterinary neurosurgeons who have had, specific training to do this.
So obviously with any surgery, there are always risks. What are some of the potential complications from that?
Yeah. So, infection, implant loosening, damage to the surrounding nerves. Those are all possibilities, but they're not super common, but it is a possibility.
And what about recovery? Like, that sounds like a pretty big surgery. How long does it take to recover from that?
Yeah, so they will need restricted activity for several weeks after surgery. So we usually say 6 to 8 weeks of, leash walks, only no running or jumping. And a lot of times we'll recommend physical therapy as well to help them regain their strength and mobility.
Of course. Now, I know we've talked a lot about the surgical side of things, but what about conservative management? Is there a role for that in dogs with C-IVDD and instability?
Yeah, absolutely. So conservative management can be really effective for some dogs, especially if their symptoms are mild and they don't have a ton of instability.
Okay. And what does that look like?
So usually we'll recommend strict rest. So a lot of times that means crate rest for, several weeks. And then we'll use pain medications and anti-inflammatories to help control the pain and inflammation. And then we can also add in physical therapy like passive range of motion exercises and things like that.
So it's really a multifaceted approach.
Yeah, we're trying to, manage their pain and support that healing process.
Of course. And I think that the key there is early diagnosis, right?
Absolutely.
Yeah.
And then once we have that diagnosis, we need to tailor that treatment plan based on, the individual dog's needs and how severe their condition is.
And I think that, open communication is so important between the vet, the owner, and of course the dog.
Yeah, absolutely. So, we as veterinarians will guide that treatment plan, but the owners play a really important role in monitoring their dog's progress, managing the pain, making sure they're, sticking to those rest recommendations. And then, of course, the dog is going to tell us a lot too. So we want to make sure we're paying attention to their cues. And if they're still painful, we may need to adjust the treatment plan.
This has been a really in-depth look at C-IVDD and vertebral instability, especially in these small breeds. And really, we've only just scratched the surface.
Right.
But I want to go back to something that you said earlier about, how we can advocate for more research and more responsible breeding practices to try to minimize the risk of this in the future.
Yeah, it's definitely a multifaceted approach. We need to be supporting the research efforts that are looking at, these genetic markers for C-IVDD and instability. We need to be, encouraging collaboration between breeders and veterinary neurologists. And then, as dog owners, we need to be educating ourselves about this condition and the importance of responsible breeding practices.
I think we can make a difference if we're all, informed and engaged.
Advocates for our dogs.
And hopefully we can get to a place where, C-IVDD is a much less prevalent condition.
Exactly. And much less debilitating one as well.
For sure. A future filled with, happy, healthy dogs that can do zoomies without pain.
I love that. So true. As we wrap up our deep dive into C-IVDD and vertebral instability in small breed dogs, it really strikes me how much we're still learning.
It's true.
Yeah.
It's such a complex condition, and there are so many factors that play a role, like genetics, age breed conformation, and even lifestyle.
And then when you throw in vertebral instability, it just adds a whole other layer of complexity.
Absolutely.
Yeah.
And I think this research has been really valuable in terms of moving our understanding forward, especially with its focus on breed-specific variations and that role of instability.
Right. And those findings about how certain breeds are predisposed to instability, I think that has some really significant implications for breeding practices going forward.
We talked about how French bulldogs tend to develop C-IVDD at a younger age, and dachshunds are more prone to those upper cervical disc issues.
Right.
It really highlights how those breed-specific characteristics can actually influence the clinical presentation of the disease.
Yeah. And understanding those nuances is so important, not just for diagnosis and treatment, but also for guiding responsible breeding practices.
Exactly. We need to give breeders the knowledge they need to make informed decisions. That's what it's all about.
Absolutely.
Promoting the health and well-being of these dogs.
For sure.
And speaking of informed decisions, I think it's worth touching on those surgical techniques again.
Yeah.
Those advancements in vertebral stabilization procedures, they're pretty amazing.
It's incredible what they can do now.
Those pins and bone cement and all that.
It's a lot of very precise and intricate work.
But it seems like combining those traditional decompression surgeries with vertebral stabilization, that's becoming more and more common, especially in cases where instability is a major factor.
It makes sense. If the spine itself is unstable, just taking out the herniated disc material isn't going to be enough for long-term relief.
Right. It's like building a house on a shaky foundation.
Exactly. And by stabilizing those vertebrae, we're essentially giving it a much stronger foundation so it can heal properly, and we reduce the risk of problems down the road.
Now, while surgery is often necessary, what about those cases where conservative management is an option?
Yeah, conservative management can be really effective for a lot of dogs, especially those with mild symptoms and minimal instability.
Okay, so what does that involve?
So usually we recommend really strict rest, often crate rest for several weeks. Pain medications and anti-inflammatories are also important to help manage the pain and inflammation. And then we can also incorporate physical therapy, like passive range of motion exercises and things like that.
So it's a pretty multifaceted approach.
It is. It's all about supporting that healing process and keeping them comfortable.
And I think the key is early diagnosis, right?
Absolutely.
Yeah.
The sooner we catch it, the better the outcome.
And then we can tailor that treatment plan to each dog's specific needs.
Right. Because every dog is different, and what works for one might not work for another.
Exactly. And I think open communication is so important.
Oh, for sure.
Between the vet, the owner, and of course the dog.
It's a team effort.
It really is. We as vets, we guide the treatment plan, but the owners play such a crucial role in monitoring their dog's progress, managing the pain, making sure they're following those rest recommendations. And then, of course, the dog will tell us a lot too.
Right.
So paying attention to their cues. If they're still uncomfortable or in pain, we might need to adjust things.
Absolutely. We want to make sure they're as happy and comfortable as possible.
We've covered a lot of ground in this deep dive.
Yeah.
From the nitty-gritty of disc degeneration and vertebral instability to the complexities of diagnosis, treatment, and the implications for breeding practices. But I think it all boils down to one really important question.
And what's that?
How could we as dog lovers advocate for more research and responsible breeding practices to try to minimize the risk of C-IVDD in the future?
That's the million-dollar question.
Yeah.
And honestly, it requires a multifaceted approach. We need to support the research efforts that are out there looking at those genetic markers for C-IVDD and instability.
Right.
We need to encourage collaboration between breeders and veterinary neurologists, and we need to educate ourselves as dog owners about the condition and the importance of responsible breeding.
We can make a real difference if we're informed and engaged
Absolutely.
and advocating for our canine companions.
I agree. We can work together to create a future where C-IVDD is less prevalent and less debilitating.
Exactly. A future filled with happy, healthy dogs enjoying those pain-free zoomies.
And lots of wagging tails.
Couldn't have said it better myself. And with that, from Vet Neurojar, keep those minds-inspired hearts, light and tails wagging.